Hi all, and welcome to this third screencast. I just wanted to take a moment to let you know kind of how things are progressing into the class. Okay, so last week we talked about learning how to develop a clinical question and a search strategy using a PICO question. And I kind of walked you through on PubMed how I used a clinical question to find a study that was relevant to my question. Okay, this week we're going to talk about different study designs and levels of evidence to kind of know that there's a hierarchy. Okay, and the next week we're going to do some kind of hardcore, maybe not so hardcore, but medium core statistical stuff. Okay, so we're going to talk about some of the data that's important. So next week's going to be a little more nitty gritty and tough. And then we're going to go through appraising a research study. And for your 6-week midterm, you're going to actually do a mini appraisal of a study that you find. So just to let you know, I'm going to use the study that I found last week and walk you through how I find the information in that study to fill in all of the boxes on a CAP worksheet, a critically appraised paper. We're doing a mini CAP, not a full CAP. And so I'm kind of so stay with me. It's all going to kind of slide into place. Okay. After that mini CAP, then we're going to talk a little bit about diagnostic tests, which is probably a tough topic as far as just the data. Okay. And then for the remainder of the semester, you're going to be working on putting together a research proposal. Okay. So it's going to be kind of based on what we've been learning, and it's building on its each thing is building on the other. Okay, so let's get started on our screencast. All right, so like I said, this unit is about the hierarchy of evidence and study designs. Okay, we're going to, so the objectives are, we're going to describe the evidence-based hierarchies used in healthcare and OT and PT. Okay. I apologize, I made this screencast for a different class that was only for OTs. Okay. We're going to describe the evidence hierarchy based on research questions and study designs. We're going to identify the CEBM level of evidence based on article abstracts. CEBM is the Oxford Center for Evidence-Based Medicine. Sometimes it's OCEBM, depending on who writes down that acronym, okay, or that abbreviation. And we're going to describe experimental study designs used in intervention studies. Before we get started, I want you to secure the CEBM levels of evidence worksheet. You can find it at the link here, and I'm also going to, it's also in the materials section for this unit. Get yourself a beverage, and let's get started. As a reminder, we have the evidence-based practice cycle, which usually starts with formulating our clinical question based on a dilemma or a problem that we might have, identifying the relevant evidence. And now we're moving towards this area where we're going to evaluate the evidence, okay? So today we're going to talk about different study designs and the hierarchy of evidence, okay? Okay, so here is a little visual of looking at the hierarchy of evidence. Okay, now this is for quantitative studies, not qualitative studies. Okay, so at the tip of the pyramid is going to be the highest quality, the level ones. And we're going to go through each of these in a little bit, but just so you know, systematic reviews and meta-analyses are compilations where researchers pull a bunch of different studies and analyze the data in those studies and make a systematic review. They may be analyzing, and they'll have criteria for the searches for the studies that they're going to analyze. Let's say they want to study effective treatment strategies for lateral epicondylitis, and they're looking at more than just one study. They're looking at a bunch of studies, and they're synthesizing that evidence together into what's called a systematic review or a meta-analysis. Going further down the list, then you have the randomized control trial. And that's Typically a level 2. Now there's different criteria for making it a level 2 or possibly a level 3, depending on certain criteria. Prospective cohort or single subject design, sometimes known as quasi-experimental studies, and I'll talk a little bit more about that in a bit. And then there's case series, which is a little further down, which is a few different case studies. It's a series of case studies, basically. And then there's the unsystematic clinical observations or expert opinion or even case review or a case study. And so as you can see, the further down that triangle you go, the more uncertainty there is. The further up you go, the more confidence you have in the rigor of that evidence, okay? Okay, so when you're looking at research studies, you can kind of look and see what the question that the study pertains to is, to kind of get a start with determining what the study design is. So for example, if you are reading a study that is trying to ascertain whether a diagnostic test is accurate, the category of the question is a diagnostic test or diagnosis. I'm not going to talk about that really much here because we will be talking about that after the midterm. Okay, what happens if we do no therapy? That's another type of study, more of a prognosis study. This third question is the one that we're really going to hone in on today and through your midterm, which is the asking the question, which intervention is most effective, or if this intervention is more effective than another one, if you wanted to look at it in terms of like a PICO. And that's a therapeutic benefit. That's a lot of research studies that you're going to be looking for and finding are these types of intervention studies, especially for OT and PT. Okay, how common is the problem? That's going to be more of a prevalence study. And sometimes that they use a lot of surveys for things like that, or retrospective chart analyses, et cetera. Is this screening test worth using? That's another one kind of similar to that diagnostic test, trying to see if a screening or a diagnostic test is accurate. Usually they measure that up against the gold standard test. And what is the potential or what are the harms? That's called kind of a category of a harm study. Again, we're going to focus mostly today on the intervention type of studies. Okay, so looking at it another way, let's look at the CEBM hierarchy chart. So if you pull that out, you can look at yours that you have, and you see those questions that I had on the previous slide here in the box on the left. And then as you go to the right, you can see the different levels or steps of within the hierarchy. And so by looking at the study and you kind of determine what the question is they're trying to answer, then that'll help you narrow down what the study design might be and what the level of evidence might be. Okay, moving, so as like I said, you've got the questions on the left column, and then moving along the top row is the different levels of evidence. And in each of the boxes below each of those areas are different types of studies. Okay, and now we're going to go through a little bit about what the studies are. All right, so when you're identifying a study design, you're going to start with these questions. Okay, so what was the aim of the study? And don't worry, we're going to, when we go through and appraise a study in the next few weeks, we're going to go through a study, and I'm going to show you kind of quickly how to find some of these answers. Okay, so what was the aim of the study? When were the outcomes measured? And if a comparison is made, what is being compared? Okay, so those are some questions that you want to start with, and that'll get you started on your appraisal. All right, so there's two different types of study designs. Okay, there's many, I apologize. There's many different types of study designs, but there's two broad categories: experimental and descriptive. Okay, so in experimental research, you're going to usually, okay, it says 3 essentials, and there's some exceptions, okay, but usually you're going to have a control or a comparison group. Not all studies have a control group, okay, but you're always going to have some kind of independent variable that is manipulated by the researcher. And we're going to go through in the next screencast what the difference between an independent and a dependent variable is. Okay, but an independent variable is what the researcher is manipulating to make that comparison. And usually, number 3 is the subjects are usually randomly assigned to groups. Okay, again, not always. Okay, in the scientific method, we want to make sure. So, the reason we use the scientific method is to make sure that, here's a good quote, that nature hasn't misled you into thinking that you know something you actually don't know. Okay, if you've ever read Zen and the Art of Motorcycle Maintenance, there's a few different key quotes that are helpful in this world, and that's one of them. Okay, we apply the scientific method to attempt to remove bias when we're answering questions. Okay, and the scientific method has a series of steps, and it starts with asking the question. Okay, and we've already done that with our PICO. And then we want to gather information about that question. Okay, so in purposes of this class, we might ask a question and then we gather the information. We're going to gather different studies that help us to answer that question. Okay, when you are doing an actual research study, you might be asking a question and then you want to gather more information about that question by reading other published studies, for example, and drawing information of things that you kind of already know to be true or things that you've observed. And then you formulate a hypothesis, which is a guess of your best guess of what you think is true. Okay. And then the experiment goes into testing that hypothesis. And then finally, we examine and report. We examine the evidence, see what the study results were, the experimental results were, and report the evidence. Okay. So and we're going to see in some of the studies that we read that you can see that they, in their write-up of the study, that they ask the question, they gather the information, which is the background literature review, usually in the study. At the end of the background literature review, you're going to see their hypothesis. It might not be worded as a hypothesis, but it's going to be their background, their purpose of the study, what they think is going to be the results or a trend. But then they're going to go through the method and report the results. And then their conclusion in the study is going to be what the takeaway message is of that experiment. So the first experimental study we're going to talk about is the randomized control trial. Okay, you hear about these a lot. They are often considered the gold standard of study designs. But there's still some that are not done well, and they're not always as good as you would like them to be. Okay, but they have a few different key factors. Okay, so they're going to be randomly allocated to groups. Okay, and that allocation should be concealed. Okay, so after you randomly selected the groups, you want to have that allocation kept in a locked cabinet or sealed envelope, for the reason being that the study researchers and the people that are analyzing the data do not need to know who was in what group. Okay, and for example, here's a study that did a review that and the review was 255 randomized control trials, and the review found that the treatment benefit was overestimated by 30% when the allocation was not concealed. So what that does, if the allocation is not concealed, and if you're a researcher and you are measuring two groups against each other and you know which group was what, you may have your own bias and you may slightly score things a little bit differently, and you may not even be aware that you do that. Okay, so it's important to keep that group allocation information separate from the study researchers and those who are analyzing the data and integrating or doing the intervention if possible. It's not always possible. Okay, the random assignment is a fundamental attribute of the randomized control trial. Okay, the subjects are going to be randomly assigned to groups. Okay, and the way that you do it is that each subject has an equal chance of being assigned to either group. You can even do it as simply as a coin flip. You may have subject 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and everyone gets a coin. I mean, you flip a coin for each one, or you draw a name out of the random number generator, draw a number out of the hat. okay? The reason it's randomly assigned is then the groups are going to be formed independent of judgment. The last thing you want to do is assign an entire gender to one side and an entire different gender to the other side. One control, one experimental, unless in fact you are comparing males and females, for example, okay? So randomly assigning them will also reduce any potential differences between the groups at baseline, okay? If you do not, so note the bottom, what I have written at the bottom, that if you do not have random assignment, it's going to bring that study down a little bit lower on that hierarchy, okay? So talking about groups being similar at baseline, you want them to be similar at baseline. If let's say you're studying your study group, you're testing the effectiveness of lateral epicondylitis interventions, and you want to measure whether electrical or TENS unit versus no treatment at all, which one is more beneficial? Okay, so some of the information you want to have at baseline, their age, their possibly their weight and their BMI, that may be a factor. But you want to make sure that, let's say you have a group of 10 on one side, the experimental group, and 10 people on the other side. You want to have them pretty equal to for gender and age, race, pain scores. Okay, if you had, if it turned out that you had a larger majority of people on the experimental side that had a lot more pain than people in the control group, and your study found that the experimental intervention of ultrasound greatly reduced the pain, well, it's kind of a no-brainer that they had more pain to reduce by. Okay, so you randomly assigning them helps to make these things equal, okay, or fairly equal. And they do a study, you're going to have the mean, these numbers down the columns of intervention control. These are mean scores, like the average scores. They're not like every individual. It's an average amongst the group, okay? And we're going to talk about the p-value more later, but what they do is they look at all these different characteristics. They calculate a mean score and look at the p-value, and the p-value will let you know if it's a significant difference, okay? Okay, so there's a few different types of designs for the randomized control trial. This one illustrates the single factor. It's the pre-test to post-test design. Basically, you randomize the groups. You've got group 1 and group 2. Group 1, let's say, is the experimental or the intervention group. Group 2 is the control group, okay? You do a pre-test. Let's say you're doing lateral epicondylitis again, and you're measuring pain and you're measuring grip strength, okay? And then you provide the intervention. So in this case, the intervention for the experimental group is ultrasound, okay? And for the control group, it is just wait and see, standard, not even standard care, just wait and see, no intervention, okay? And then at the end of the intervention time, you do a post-test and you remeasure pain and you remeasure grip strength, okay? Let's look at a different design, all right? So it's a similar thing, but now you have a couple different another group. Let's say you're measuring, in your group 1 is ultrasound, group 2 would be general strengthening, and group 3 would be nothing, or like just wait and see. You can look at any of the interventions. We can do electrical stim, we can do TENS, for example, but I'm just trying to give you the example, all right? And so again, you're going to have the pre-test of the pain and the grip strength, for example, do those interventions, and then remeasure those as a post-test. Okay, and each study is going to be a little different of when the pre-test, the intervention, how long it lasts, and when the post-test happens. Okay, this is something similar, but it's a repeated measure. Okay, it's still the single factor, meaning it's still the one intervention, the one intervention time period. You've got the 3 groups, or possibly the 2 groups, because you can apply this repeated measure to a 2-group assignment. But you do the pre-test, do the intervention, Post-test could be, let's say it's immediately upon follow-up of the intervention, and then post-test 2 could be a follow-up 6 weeks, 12 weeks later, depending on what it is what the intervention is that you're measuring, okay? So just so you know, you have that baseline, which is the pre-test, the intervention, and then the post-test, and then the repeated measure means you do a follow-up post-test. Here's another version. Let's say you're doing a factorial design, a 2x2, okay? So the 2 factors, okay, in this case, the factors are the 2 genders, okay? And the levels across the top row are 2 different types of training, okay? So in this case, you are exploring effectiveness of running, okay? Training for marathon running with males and females with high temperature and low temperature. So you're comparing 2 genders, but also with the high and the low temperature as far as what's more effective for increasing endurance and performance. You could add a 3rd level, okay? Same thing as before with the the effective temperature on males and females athletic performance for marathon training. And you're comparing males against themselves with the high, moderate, and low temperature training, and females against themselves with the high, moderate, and low temperature training. 2 factors, 3 levels. Now we're moving on to a different type of study design. It's called quasi-experimental, okay? So the word quasi, as defined by Webster's, means supposedly, seemingly, apparently, but not really. So it's kind of experimental, basically, okay? It's going to be less rigorous, okay? A couple things that it might lack. It's going to lack the random assignment to groups, or it may lack a control group, but it does provide an alternative to randomized control trials. And the reason that's important is it's more convenient to conduct. It's less disruptive to the sample. A lot of times, they're far easier to put together a quasi-experimental study than it is to do a randomized control trial. It's a lot easier to gather enough participants and put all the planning together, okay? But by the same token, you need to know that there's going to be more bias potential in this type of study, okay? Okay, so here's a 1-group pre-test, post-test design, okay? So you're not having a control group, okay? You've got 1 group, all right? And you are doing the baseline measurements of the pre-test, and then you're doing the intervention, and then you're doing the post-test, okay? So in this case, the independent variable, the thing that is being manipulated by the researcher, is not different interventions for different groups, but it's time, okay? Time is the independent variable of the time between pre-test and post-test, okay? And the reason the independent variable is time is because all of those subjects are receiving the same intervention, okay? Now, there's some validity threats. For example, if we're talking about the lateral epicondylitis and you wanting to reduce pain and increase hand strength or grip strength, you may see that the intervention that you're studying shows decrease in pain and increase in grip strength. But if you have nothing else to compare it to, it could just be that time helped with that, okay? Let's say you're doing a different study sample on a handwriting intervention for kids, and you take a baseline measurement, give them the handwriting curriculum, and then you do a post-test. Maturation, kids are always learning in school. So it could be just that they had more opportunity to practice it as a regular given day and given their time in school. So it's tough to tell if it was the intervention or how much the intervention helped. That's why it does help to have that control group. Here's another variation of what we just talked about. You've got the study sample, okay? And you're doing your pre-test, your intervention, and your post-test, but then you're doing a follow-up post-test, okay? Or in the bottom example, same thing, you've got a study group, you're doing the baseline characteristics at the pre-test, do the intervention, do a post-test, and you can do either another intervention or the intervention again and do a post-test again, okay? So just a few different variations. All right. Here's another variation. It's called a non-equivalent multiple group design. And these are non-randomized groups, but you're comparing two groups, okay? And the reason you don't randomize them, let's say you're doing two classrooms, for example, and you're doing a handwriting, you're measuring the effect of a handwriting curriculum, okay? And you want to compare one class that didn't get the handwriting curriculum training with the other classroom that did. And the reason you compare classes like this is kind of hard in a classroom setting to randomly do some students that get it and some who don't, because they're all in the class together, okay? So you would basically chunk the experimental group would be one classroom and the control group would be the other classroom. Another study design is called a single subject design, okay? And what this is you can use, it's kind of a misnomer. Saying single subject design makes you want to think it's only one study participant. But you could have multiple study participants in a single subject design, okay? But each subject is serving as their own control, okay? So for example, let's say you are doing the effect of video modeling on a student learning, let's say you're doing, let's do a sensory thing for the OTs in the group here, and you want to determine if use of a weighted vest helps a student with autism maintain focus. And you're measuring the incidence that you can like track with a tally mark, the incidence of being out of their chair, for example. Okay, so use of a weighted vest to help them with seated concentration. Okay, so each subject, and let's say you're going to make observe one student at a time, or you can have multiple students observed as long as you can carefully observe them. And their baseline is you just basically take a measure of how many times they're out of their chair in a certain amount of time. Okay, maybe it's between 11 and 11:30 every day. Okay, or for example. Okay, and then that's phase A. Okay, that's the baseline. The B part is then you have them wear that weighted vest during that time period, okay? And you still you can use a little clicker or tally marks of how many times they're out of their chair, and then you remove that weighted vest. Again, let's say you're doing the baseline for a week, you do the weighted vest for a week, and let's say you do removing the weighted vest for a third week, and you click. You use a clicker or make the tally marks of how many times they're out of their seat. Okay, so you can see that in this illustration graph that the use of the intervention, and I'm just using this in the weighted vest as an example, that the use of the weighted vest helped decrease the number of times that the student stood up out of their chair. Okay, well, you can do that with many subjects, and then you just report it for each subject, but you can also then tally up the average number for all of the subjects, okay? So but each subject is being used as their control, okay? This is oftentimes, you're gonna see this a lot, this study design in the autism research, okay? So you wanna make sure that you have the repeated measures. You're gonna take it throughout the study. Okay, some of the target behaviors you can count for these would be a frequency of how many, like I said, the frequency of somebody being out of their chair. Or you could have an interval recording. Let's say that a meltdown is happening. You can record how long the duration of a meltdown. Okay, you can do some kind of other quantitative score. Okay, so just to kind of keep this in mind when you're looking through some of these studies. Okay, so here's another variation of the single subject. This is a multi-phase design. As the illustration on the previous slide talked about, it was kind of the ABA approach, which is the baseline, intervention, and then baseline again, where you have the baseline, then the treatment, and then you withdraw that treatment as the secondary baseline. Okay, the withdrawal phase adds a second baseline, okay, and a second treatment. Okay, so the ABA is 2 baselines, okay? And it allows you to observe your target behavior and measure without, you measure the target behavior without the intervention, and then you measure it with the intervention, and then you take away the intervention and measure the target behavior again without the intervention. But the ABAB is a stronger design where you start with the baseline, okay? Then you provide the treatment and make your measurements during the treatment. Take away the treatment, going back to your baseline, and then you go back to a second phase of treatment. And what that does, if you see that variation, and you can see in the chart that just looking at the numbers, I don't know what this chart was measuring, but let's just say that you're measuring attention using a wrist device that vibrates on their wrist to help them pay attention. You take the baseline, they're not paying attention, the number of times that they're actually focused on the teacher instead of looking off into space, give them the intervention with the wrist device, see how many times they're paying attention. Then you take away the wrist device, see how many times they're paying attention, and then add it back. And it just kind of, you can see how having that second treatment phase really does strengthen the validity of your findings. Okay, it gives a second opportunity to determine if in fact that intervention was effective. So some assumptions of single subject designs. Okay, so you're going to have threats to internal validity, but you can control them through the replication. Okay, so you're going to compare between the subject behaviors during baseline and treatment phases. Okay, and then the repeated measures allows you to compare more for consistency. Your measures must be reliable and valid and sensitive when measured repeatedly. And we'll talk about some of those characteristics later, okay? Target behaviors or measures are reversible. So as you saw in those graphs, when the intervention was stopped, the changes go back to similar to baseline, okay? It's not easy to generalize this intervention to a broad population because of just the way the nature of the design is. We were talking a bit about the experimental research. Well, now we're going to talk about descriptive research. Okay, descriptive research is designed to document factors that describe characteristics or behavior or conditions of individuals and groups. It might document the nature of existing phenomena and how variables can change over time. Descriptive research might be prospective, which is looking forward into the future, retrospective, looking back into the past, longitudinal or cross-sectional, okay? There's different types of descriptive research. There's developmental, which is describing the developmental change and sequencing of behaviors over time. The progressive changes that might occur to a population over time, for example. Natural history, you might use this type of research to document the history of disease states. That's a lot of observational and looking back at data, okay? Normative might describe typical or standard values of a given population. And qualitative studies is not the quantitative, but the qualitative, where you're going to explore perspectives or lived experiences, and it's going to give you the data that it's going to give you, gives you some perspective on the complex nature of how humans or how people perceive their experience within a certain context or a certain experience. And it avoids the logical positivism by adopting an interpretive or collectivist philosophy and worldview. One form of a descriptive study, and you possibly have participated in this, is a descriptive survey. You're going to collect information about specific groups to describe characteristics or risk factors for disease or dysfunction, for example. It doesn't have to be disease or dysfunction, but like surveys, there's a lot of surveys about a lot of different things. And this survey will help give you a picture of the group characteristics, okay? And then you can also do some correlational interpretation and comparison. The methodologies can vary. You can get surveys by mail, in person, through email, different electronic medium. Here's another type of research is the case study and the case report. You got to be careful in calling it research because it's really not actual research. The IRB, which is the Institutional Review Board, does not need to approve a case study. Okay, but what you're doing is you're providing a lot of in-depth documentation of a particular unique case. Okay. A case series is an expansion of the case study where you're going to be doing observations of several similar cases. So we'll take that case study and have similar clientele or a similar intervention, and you're going to be reporting on each one of those, and it becomes a case series. Okay. Case studies are usually retrospective in design, where you're looking back in time. Okay. They are prone to measurement error and bias. Okay. Because you're not, first of all, you're not going through the IRB, the strict IRB process to help you avoid some of the bias potential. Okay. And measurement error, it's usually one therapist or one practitioner making those measurements with one client. And by reading the case study, you don't know as the consumer of that case study if the outcome measure or the measurements were adhered to. It's tough to tell. Okay. It's good if when they write the case study, it'd be nice if they actually wrote and how they, specifically how they did the measurements, but you don't always see that. Okay. Case studies are the lowest form of evidence in the evidence hierarchy. It's basically considered expert opinion. But if you think about it, how do we as practitioners gather our clinical experience? Every patient is a case study. We might not be writing about it, but every patient is a case study. And that's how we gather that information to go, well, in this particular client that has this particular diagnosis, I tried this, this, and this, and this one worked. And I'm going to try that again with the next client that has a similar presentation. Like I said, they're not seen as actual research, but it is in-depth documentation of a particular unique case. Case studies are kind of fun, especially if you have clients that have a diagnosis that you don't see very commonly. And it's hard to get like very rare genetic conditions, for example. There may only be like 12 of this particular genetic mutation in the world, and you're not going to get a randomized controlled trial about a certain intervention with that genetic mutation. So you need to look at those case studies. Okay. And like I said, the case series is an expansion. They're both retrospective in design, but the case series is a little bit higher up the evidence hierarchy. A case series can be as high as a level 4, whereas a case study will be a level 5. All right, here's a chart, and you can go back and look at this in your leisure. But this gives you a little kind of a cheat sheet of what types of information or what types of research questions might be best answered with what type of study. And again, I am providing you the PDF of this slideshow, this presentation, so that you can take notes and review, look back on it later.